Pregnant women, new mothers, and their partners are usually concerned about jaundice in the newborn babies because they have heard a lot of things or they have had different kind of experiences about jaundice in newborn babies. What is jaundice? Jaundice simply means yellowness of the skin, of the eyes, and other parts of the body. What causes jaundice is very easy to understand, just like in secondary school biology and those basic sciences. One of the important cells in our body is what we call red blood cells. And as a living thing, it has a lifespan, it grows old. So when red blood cells grow old, they are broken down into different products in the body. One of the products that is broken down in the body is what we call bilirubin. Is that bilirubin that when it's in excess, when the body does not take care of it properly and on time, that causes yellowness of the eye, of the skin, and other part of the body. And that's what leads to jaundice. Newborn babies particularly are likely to have problems with jaundice because there's a part of that bilirubin. There are two types essentially. There's one of it that when it is in excess, it can go to the brain, damage the brain permanently, and make the baby to become vegetable. And that is why it's important we talk about it. Every newborn child can have jaundice because the cells in newborn baby don't live as long as those in adults. So the body breaks them down. As the body is breaking those cells and bilirubin are being formed, the body of a newborn baby might not be able to take care of those things rapidly and promptly as expected. Now, some babies will be able to cope and there will be no problem. And that's part of the normal process by which they transit into life outside of the womb. So we usually test for all babies for jaundice only in second to third day of life. And if the level is not so abnormal, we assure parents and counsel them to continue to check for jaundice. But if jaundice is seen in a baby in the first day of life, that raises an alarm that we should know what is going on. Who are babies that are particularly likely to have problem with jaundice? Like I said earlier, any baby can have jaundice. But babies that are born to parents that have rhesus incompatibility, and this means that maybe the mother is rhesus negative, the father is rhesus positive, such baby may have problem with severe jaundice. Babies that are born with parents that have blood group ABO that are not compatible, maybe the mother is O positive and the father is another blood group and baby is not O positive. Some of those babies may also have problem with severe jaundice. Babies that are born preterm, that are small, babies that are born to diabetic mothers, or babies that are born, they have serious infections. Such babies are likely to have problem with jaundice. And babies that have problem with the way the shape and the structure of their red blood cell are, which make the body to readily destroy them, they also have problem with jaundice. So we usually test all baby for jaundice from second day to third day of life. The result will determine the step that will be taken. And when a baby has been discovered to have jaundice, the right thing to be done in the hospital to have severe jaundice, if the level of jaundice is higher than what is safe for the baby, the doctor will counsel parents on the right thing to do. And especially when the baby have all those things I've mentioned, are born to parents, have those conditions that can have such problems, and babies that have older siblings that have jaundice before, such babies are usually put the health worker on their toes to look out for problem with jaundice. So when jaundice is discovered to be severe, we usually have two common ways by which we treat them. The commonest is what we call phototherapy. The baby will put under a special type of light. That light helps to bring the level of the jaundice down to a safe level. In very bad and severe cases, we can also do blood transfusions. And a lot of babies' life and function have been well managed through this. But the challenge in the public is that there are a lot of beliefs that make our people not to make use of this proper management of jaundice. One such common belief are people believe they can use proper water to treat jaundice. This is very wrong. And a lot of babies have been made vegetables, have their brain permanently damaged because of this. Some parents also believe that they can carry their baby and put under sunlight, early morning sunlight. While early morning sunlight has some degree of light that can be useful, but usually it is not enough for proper treatment of jaundice. And people also believe that malaria, if malaria is not properly treated, pregnant women may believe this in pregnancy. That's why there are people who have jaundice. No, malaria is not a common cause of jaundice in the newborn. And having highlighted it is now very important that our people need to turn a new leaf so as not to be given birth to baby that have brain damage from improperly treated jaundice. So when your baby is born, which one we are in the hospital where they would check the baby. These day all babies are checked from second to third day of life for jaundice. And if it is normal, you continue to check your baby at home to see any sign of jaundice, yellowness of skin or eye. At any time you notice anything, come to the hospital for prompt treatment. And when you have been counseled that your baby need a particular type of whether phototherapy or blood transfusion, listen to the health worker so that you can give birth to baby. You can have babies that have good quality life, who will be brilliant and geniuses like Albert Einstein in the future. And I hope that this short health talk will go a long way to help our people to have a different orientation towards jaundice in the newborn babies.